Hi there, this is Laura Edge-Hughes and this is your 4-Leg Rehab Minute, and today's minute I want to talk about how to improve gait in a dog with bad hip dysplasia or post-operative, whatever, FHO, TPLO, for hip dysplasia. Basically, dogs that have crappy hips. So you've likely seen these dogs, and if they've got really bad hips, they are not extending their hip out like this, not nearly as far as this, right? They're doing that crunched up walk because it hurts to get their hip out this far. Even after they've had surgery, oftentimes they're like, yeah, no, I can't do that. It used to hurt, and or everything, their iliopsoas and sartorius are all tight because they haven't been going back there. Now, what often happens in these dogs that have the hip pain, in order to get full push off, they take it from the tarsal joint. They take it from the hock. And you will often see those dogs hyperextending at the tarsus. And then if it's really bad, they get a lot of laxity, even medial and lateral collateral ligaments in through there. And they get a fairly unstable tarsal joint that hyperextends with any kind of push off. So what I have found makes the most sense and works well for two reasons. So one, I would recommend putting a soft brace onto the tarsal joint. So whether you use something like a TheraPaw, whether you use their tarsal flex, or whether you use the back on track. I did a video on that. Look for that back on track brace, and then you put like elastic tubing on the front to kind of hold that flexed position, all just so that we don't hyperextend through this tarsus, and therefore, I'm getting too fast in my thoughts and my face isn't keeping up. Therefore, what should happen is the dog will try to take extension from the hip because we've stopped a certain amount of hyperextension at the tarsal joint. So two things. I think is good because it protects the tarsal joint, okay? And I also think it's good because it helps to facilitate the hip to go into more extension and take up some of that motion. So it can be used to prevent prevent further injury and protect, but it can be rehab wise for the hip to try and get them to extend the hip a little bit more. So this came from a question and a conversation from a rehab colleague out in the other portion of Canada, and we had a bit of discussion going back and forth, and I'm like, this would make a really good 4-Leg Rehab minute video, so that y'all think the same. Well, you don't have to think the same thing, but y'all think about this as an option, and if you think it's horrible, go ahead and put a comment down here and we can chat it out. But anyways, just as a thought process, that's where I'm at in looking at these cases. That's it. Little tidbit. Until next time, cheers.